Hello relatives, welcome to this week's Schlagbite for the week July 2nd, 2012, entitled I Have a Dream. Thursday, the Supreme Court issued its historic decision on the Accountable Care Act. I was speaking to the Indiana Hospital Association where they broadcast it live. When the reporters first announced that the individual mandate was unconstitutional, there was an audible gasp in the audience because it meant that for hospitals it was going to be business as usual. That means for safety net hospitals, those who see lots of emergencies and uninsured patients, it meant no relief. But then they corrected themselves and said that indeed it was constitutional and you could hear a sigh of relief. The reaction to the decision was predictably divisive, with politicians vowing to repeal it. But I want to tell you that whatever happens from this time forward, how healthcare is delivered in this country is going to change. And it's about time. It doesn't matter what your political persuasion. Everybody knows that we can't afford to spend 20% of our gross national product on healthcare. It's 18 times higher than any other country in the world. And we are not the healthiest country. We're not even in the top 20. I mean, we're extremely good at what we do, acute care, trauma. But 85% of all healthcare costs are for the treatment of chronic diseases, hypertension, diabetes, mental illnesses, obesity, and for people in the last 18 months of their lives. We can provide better, cheaper healthcare if we move from the current interventional model to one that's based on prediction and prevention. That's the wave of the future. And I spoke about this with my friend and colleague Scott Wartleman, the president and CEO of Fairview Red Wing in Minnesota, and we outlined a model that moves hospitals beyond their institutional walls and into the community, where they help integrate existing resources. We talked about the difference between healing and curing and how to make heartfelt connections with people in ways that inspire them to become the principal agents in their own healing. That's how you impact chronic disease. The Affordable Care Act signals a dramatic cultural change in healthcare delivery, and I am feeling wonderfully about it. I mean, so good that I took a couple days off to celebrate after I spoke in Maine last week. I stayed in a cottage that was built over the water. It came with a hot tub on the outside deck that looked over Penobscot Bay, where I watched the sun rise and set. I read, I dozed, I picnicked on a mountaintop overlooking a quaint harbor with its tall sailing ships. And I ate lobster at dusk as I was enveloped in a misty fog. It was a delight and reminded me that I have a dream. I can see the dream. It's a dream of a healthier nation. I see it happening, and I welcome its presence on this 4th of July weekend as we celebrate our freedom. Let's celebrate new beginnings that remind us of what it is that we can be and be in health. Have a great, great week. Stay connected. I say this for all my relations. Mitakuye.